In this video we are going to see the histology of the uterus. First of all, let's see some identification point, and then we look for the histological diagram and then histological slide. Uterus is the female reproductive organ, and in the uterus there are various changes that took place during the puberty. Various hormonal changes that takes place in the uterus. So first of all, I look for the proliferative phase of the uterus. In the proliferative phase, we can see that lining epithelium is columnar cell. There is spiral arteries present, which is up to middle part of the stratum functionalis. Uterine gland are also present in the endometrium. Endometrium is consist of two layers. First of all is stratum functionalis and stratum vessel. In the menstruation, stratum functionalis is shed off, while the stratum vessel is remain. So there is a spiral artery in the stratum functionalis up to middle part of it. It arises from the stratum vessel and reaches to the stratum functionalis. Now we look for the myometrium, consists of the three layers, in which inner longitudinal muscle, middle circular and outer same longitudinal muscle are present, and perimetrium consists of serosa. Now we look for the secretory phase of the uterus. Same, the lining epithelium is columnar cell. Spiral artery are found near the lining epithelium. Uterine glands are tortuous. In this, at the proliferative phase, this is the main difference between the proliferative phase and secretory phase. In the proliferative phase, uterine glands are present, but they are not so tortuous, and they remain smaller in size or in normal size. But during the secretory phase, where there is various hormonal actions in the uterus, in the body of the female, then uterine glands are tortuous in the nature due to the various secretion. Then myometrium consists of the three layers in it. This is same as the secretory proliferative phase, and same as the perimetrium also. So main differences for the uterine, by seeing the uterine gland we can differentiate between the proliferative and the secretory phase of the uterus. Now I look for the histological diagram. These are the two histological diagram of uterus. Although this is not so much perfect, but you can appreciate that here we can see that stratum functionalis, this is the outermost part of uterus, and in the innermost part is the stratum vessel. This two part forms the endometrium, and then we have the layer of myometrium, and at last the perimetrium. And here we can appreciate these round structures which are uterine glands. And you also can see that lining epithelium is columnar epithelium. Columnar epithelium are just like this way. This is the columnar epithelium cells, and gland also made up of columnar epithelium cell. This is the proliferative phase. And in the secretory phase, what happened? This uterine gland is bulge off, and there is much more arteries are present in the endometrium, while in the proliferative there is a not so much vascularity, but in secretory phase there is a much more arteries present in it. So these are the two diagrams of uterus in two different phases, proliferative phase and secretory phase. Now I will look for the histological slide. So you can see this is the histological slide of the uterus. This is the proliferative phase, as these uterine glands are not so tortuous. You can appreciate that these are not so tortuous. So this is the proliferative phase. In the secretory phase they became much more thicker and tortuous, and much more blood vessels are also present. Here you can appreciate not so much little bit not so much H. In the secretory phase there are much more blood vessels and much thicker uterine glands. So this is the proliferative phase of the uterus. Thank you. If you like